Hi, I'm Susie Trotter. I'm with the Virginia Department of Health, the COVID-19 testing team, and I co-lead with a robust team. And I'm here today to share with you a state of the state for testing. As I imagine you all are acutely aware that it's in flux as far as supply chain and demands. So I'm going to go over a few points, pearls of wisdom for where we are this week. There is certainly a flurry of communications. We're getting everything, as I'm sure you are too, where can I get a test, to distributors saying they have tests, to providers saying they want to be able to test and how can they support it. As additionally, we're getting some more national movement. We're hearing a little bit more word about when the 500 million tests will get out to individuals, and we expect that to roll out online next week. As well as some funding that's now available where insurance will now be able to cover at-home rapid tests for individuals. So all of that is in development. So really our takeaway here at the state level is that folks are hearing the health messages. It's important to test. We do want to test, and the turnout is strong for that. We're also seeing a little glimmer of light that the availability is opening up in the marketplace. Granted, it is at the distribution level and not necessarily on the shelves where folks can purchase it, but we're seeing the release now. It's starting to open up. Additionally, it's great. Providers have stepped up. They want to help, and we've steered them to the business licensing department in their county, as well as Office of Licensure, to get CLIA waived. So it's really a robust response in Virginia, and we're appreciative of everyone's efforts. But where we are now, certainly some risks. So when we're talking about rapid testing, it's a little bit of a moving target right now. The supply chain is opening. However, it is a marketplace, fair share. Our prices range everywhere from 12 hours this cost will stand to we need you to pay everything up front. So it's a little bit of a challenge and a little bit of finesse to get the product. We work within the state procurement processes, and we've done some emergency purchasing as well. So we are getting a trickle in, but it is right now, the marketplace is a little challenging. It's compounded, as you all can imagine. The industry is considering the peak, which we hope to say there's an early and hopeful signal right now that maybe we are at the peak, which means that would be a rapid drop off for testing. So the market is trying to get as much bulk shipped out as they can. So we have heard that there's been distribution requests at the federal level from the distributors, half of it to feds, 40% is to pharmacies, and 10% is for the states. So it's not just the state level that's getting resources, but now it is all over, which is an exciting news. Of course, we also heard about the Supreme Court that did block the order to have businesses test, vaccinate or test. So we may see a decrease in testing. So that will impact, of course, the availability of tests and where they will be. And in additional, I'm sure you're acutely aware of the workforce. Our workforce has been impacted by Omicron. So our our testing appointments are at a premium. As well as the workforce that's able to do samples. So what I can share with you today is really the accomplishments, knowing you all know the challenges of getting testing out there. We are seeing a high volume of testing come through our reporting portal. We're actually at a higher rate of tests coming in this month than the same time last year, January, during that peak. So it's slightly above. We're getting both PCR and antigen. In addition, our safety net is well attended to through our CDC epidemiology and laboratory capacity grants that we have for our safety nets. So that would be our long-term care, our shelters, federally qualified healthcare centers. We're supporting local health departments, our jails, our prisons. Again, the safety net of where the high-risk congregate facilities are. We are able to get testing, and we have been. It's just at a trickle. So it's a constant daily effort to prioritize and be sure that the high-risk concerning areas are getting testing. In addition, We did launch a successful pilot with a library program to distribute free testing that really canvassed the Commonwealth. So it was at all corners, which was very helpful in getting tests out to the community during this phase of Omicron. We are evaluating that program and are looking to purchase a new product, and we'll push that out again beginning next month. And then, as you might have heard, we have stood up 9 community testing centers across the Commonwealth. We requested expedited FEMA project. And what this will provide is an additional layer of testing. So it will not impact what we have going already. It will be added tests. So we expect to add over 50,000 tests just for the month of January. We leaned into what we already had for success, which is our CVCs, our community vaccination clinics, that were already predetermined through a rigorous process of data evaluation, looking at population density, social vulnerable indexes, and those have stood up and been highly successful. So we patterned after that in order to get this project up in just a little over a week. So we'll have rolling openings. So far this week, it's been robust, 100% capacity for our tests. It's appointment only, which has been a benefit for the community. So there's no long lines. They know when to come. They get to, it's pre-registration. So when they get to the door, their registration, their slip is there. They get in the line to get the sampling, and they're really out within 4 or 5 minutes. So that's been a huge success. We're tapping into our lab capacity for that. So we're using our state lab, DCLS, including the One Lab network. And in addition, we have state contracted vendors that are able to add to our lab capacity. So the community testing centers is a project where we've partnered with an emergency response vendor, Ashbrit, who then partnered with a healthcare agency, it's IEM, which is fully staffed, everything from the chief nurse officer, nurse practitioner writing the order. It is certified, vetted samplers, so LPNs and RNs on site. It's a full component that's able to do the sampling and testing, and then we have couriers that send to the labs. So again, it's a complement to what's already going on to address the urgent needs that we have right now with Omicron. In addition, we're going to continue it through March, depending on the FEMA funding, but then we will hopefully relax a little bit from the urgency right now and have more of a systematic approach to testing. Testing's not going to go away after Omicron peak. It's going to continue. And then lastly, I wanted to speak to you a little bit about reporting. We are working on our messaging at the state level through containment, that it's really not necessary. First off, a little bit more communication on when to test. It's been a little bit of a roller coaster with the CDC recommendations, and so we're solidifying that when and who should get testing. And then at that point, we're shifting the dialogue from reporting it to your healthcare provider or reporting it to your local health district. That was early on messaging. We needed to get a grasp of where the cases were. I think we have a really good grasp now of where that is. The only time our messaging will be, the only time you really need to call your healthcare provider is when you're having symptoms and you're symptomatic and you're unable to manage that at home, or if you have a comorbidity or some other condition and some alerting symptoms. Other than that, they do not need to report to their healthcare provider that they had a positive COVID test. Additionally, we're working at this state, national level, some communication to manufacturing, because all of the manufacturers have a product list, a direction, a guide inside those rapid tests that say report your result to the healthcare provider. So it would be recommended that maybe on healthcare providers answering machines or voicemail to go ahead and place, the message that if you don't have an urgent need, if you're able to manage your symptoms at home, you do not need to report the test to us, but if you need an appointment for healthcare, that's another avenue. So that's one suggestion while we work on the messaging on our side. So all in all, that's the update of the state for Virginia right now. It is flux. We're working daily to manage both supply and demand, and really appreciate all our partners that have been working so diligently for 2 years now throughout the pandemic. So I thank you for your time and wish you well.